morning, Facebook. We are streaming live from the National Medical Association 114th Annual Convention and Scientific Assembly. I have the lovely Miss Faith Cooper. She is from Ghana, and she is also the International
Public Health Professional and Regional Advisor for the West Africa Disaster Preparedness Initiative.
That's what she said. So we are blessed to have you here. You recently did a talk.
Yes.
Tell us a little bit about that, what you do, and why do you do it?
Great, thank you very much. It's a pleasure to be here. I was actually invited by the National Medical Association to speak on my work in Africa. As I mentioned, I'm the Regional Advisor for the West Africa Disaster Preparedness Initiative, which is an initiative that came about to respond to Ebola, post-Ebola capacity building. We are working across Africa, primarily West Africa. We are building African nations' capacity to respond to disasters, pretty much supporting African professionals to take control of their own destiny when it comes to public health preparedness. So being here has truly been an honor for me. Yesterday I presented on ending the global HIV/AIDS epidemic, progress and challenges.
Say that again.
Ending the global HIV/AIDS epidemic, progress and challenges in Africa and the Caribbean.
Thank you. Thank you for your work.
Thank you very much. And that is very important, particularly because the challenges that we are seeing across the continent of Africa are similar challenges being faced by minority communities here. As you know, there are 36 million people currently living with HIV and AIDS. And of that, 25 million are in sub-Saharan Africa. So that tells you 70% of HIV/AIDS cases are in sub-Saharan Africa. And 90% of the AIDS-related deaths are also in Africa. So we are working across the region, West and other countries and other regions to build the capacity for public health preparedness. Because when you do that, it applies to all sorts of public health. HIV is a major public health concern for the continent of Africa. So if you strengthen health systems, if you build professional capacities, if you train them in all areas that relate to public health preparedness, you're ultimately building Africa's capacity to respond, be it Ebola, the new thing that's coming up, Zika, which is already on the continent of Africa and is here in the United States as well. I think when I landed from Ghana a few days ago, I read something about Zika now being in one of the states. I can't remember if it's Florida. Yeah. And so it makes it a reality in that whatever is happening around the world globally impacts all of us. So if we don't partner together, if we don't work in a collaborative manner to address public health concern, we're all going to be impacted. Particularly when you look at HIV/AIDS. HIV is a global health threat. And we need to forget about borders. We need to stop thinking that it's an issue in Africa. We need to stop thinking about it as a black issue. It's all of our issue. So being here at the National Medical Association with thousands of black physicians, public health professionals, physicians that treat black patients, it's important for us to work together to develop strategies and to look at successful models that work. Model which is such as what I'm doing in Ghana. And certainly it's a collective effort. I'm a regional advisor, I'm supporting and directing the program, but we also have a number of people that are part of putting this effort together. And so when we look at our partners, we look at the U.S., we look at foreign government, we look at African organizations, Economic Community of West African States, ECOWAS, the African Union, the AU, Kofi Annan International Peacekeeping Training Center, which is where I sit. We all work together to put this model together for Africa. But we're starting to realize that it's a model that can be applied across the world.
Now, how long have you been applying this model in your area?
The model actually came about under a program called Operation United Assistance, which actually was the vehicle through which President Obama's National Security Council provided Ebola response support to Liberia and other countries impacted by Ebola. So remaining funding from OUA.
What's that? What's OUA?
OUA is Operation United Assistance, which was United States government support for Ebola, which was tremendous. Once the international community became engaged, they worked with African partners to get us to where we are today for the entire region to be free of Ebola. But we can't get too comfortable because there are other public health issues. There's Zika, there's something in the future, there may be other things in the future. So what's important is for us to build the internal capacity. We appreciate the international community, we appreciate the United States government effort and all others that band together to support Ebola response. But what's important is to build the capacity of African nations to do that. And we're the National Medical Association, the W. Montague Cobb Institute, which my career started here. I used to work for the Cobb Institute for 5 years as project director. So to be able to come back to an organization where it all started and talk about the work in Africa, my passion, because the Cobb Institute laid the foundation for me. So to be able to come back and do that, my primary reason for being here, yes, was to give the HIV/AIDS talk, but also to work with the NMA and how can the NMA support efforts that's happening on the continent. The NMA holds a gold mine, which is minority physician database, primarily African American providers. How can they work with African providers on the continent of Africa, physician exchange opportunities, research, clinical opportunities, work together to fundraise. We could go to UNAIDS and other organizations to address this issue, because the bottom line is unless we advocate for ourselves, unless we make this a global issue, no one is going to do it for us.
Now for your program, what progress have been made? In what countries that you have united since the beginning of this program?
Yes. One of the things we realized and why this program was so important, the West Africa Disaster Preparedness Initiative, is that when Ebola happened, almost 2 years ago now, let's remember, more than 11,000 people died from Ebola.
In what area?
Primarily in Liberia, a country where I was born, Guinea and Sierra Leone. Those are called Mana River Union countries. They bear the brunt of what was happening. Now you have countries such as Nigeria that also experienced Ebola. But if you understand the economy of Nigeria, they were able to quickly mobilize. They had the resources and they attacked it so quickly and so swiftly. And so we need to look at those examples. When you look at countries like Liberia, Guinea, and Sierra Leone, 3 of the poorest countries in West Africa, dealing with Ebola, you can imagine the impact on the economy, on the educational system, and everything. So one of the things we realized is that during the Ebola response, the reason why the virus kept going as long as it did was also, one of the reasons was because of lack of coordination. Internal coordination within the countries, as well as regional coordination. So think about it. If you live in Washington, D.C. and there's an outbreak, whatever impacts Washington will impact Virginia, will impact Maryland, and go down from there, Delaware, Pennsylvania. So it is important for those states to work together and develop a broader strategy. Similar thing happened with Ebola. Initially, the countries didn't know what they were dealing with. West Africa had never had Ebola. That's the first issue. Ebola had happened in East Africa. They've been able to respond, but never had it enter the capital city, a capital city in East Africa.
Capital city.
In West Africa, it was in all of the capital cities in those 3 countries I mentioned. So capital cities are usually densely populated.
That is very true.
And Ebola is an emotional disease. It's an emotional virus. If I touch you and interact with you and there's bodily fluid, I will pass on the virus and so forth. So lack of coordination internally, lack of coordination at the regional level. So this WADPI, this West Africa Disaster Preparedness Initiative, came about to support regional coordination, regional collaboration, and regional communication. And from there, we were able to pull in 14 countries.
Wow.
13 of them in West Africa, 1 in Central Africa. And so we have trained 95% of West Africa, or 98% I would say. We're getting ready to train another country, Cape Verde. And so that's important because should this region experience another incident such as Ebola or anything else, they are better equipped. They now understand the importance of regional coordination. Whatever impacts you impacts me. If you live close to me, if I am your neighbor, you're only as safe as I am. So they are working together to promote that regional model. And that model is now being looked at potentially being implemented in other RECs, regional economic councils within Africa. So you've got southern area, you've got eastern, you've got west. And so ECOWAS has been spearheading this. Kofi Annan has been a primary implementer in the National Disaster Management Organization of Ghana. So it's certainly been a collaborative effort. It's been a partnership, and then notwithstanding, it is supported and funded by the United States government, specifically U.S. Africa Command. They provided the seed money. Now we're looking for opportunities to expand this and to continue to bring U.S. partners on board, NMA and others, to build the capacity and to exchange information.
Now, the other question is, what obstacles have you faced in just throwing out some ideas? What obstacles have you faced in trying to train? You said 98%?
We've trained almost all of West Africa. Let me be specific. We have in total, we have trained 1,368 people.
That is amazing.
Disaster managers across Africa, public health professionals, operations guys. And of that number, we went to one of the countries that was disproportionately impacted by Ebola, which is Liberia. And Liberian government spearheaded an effort to replicate that WADPI model in Liberia, therefore training an additional 450. So it makes our number 1,368. But this is a train-the-trainer program. So you pass down and they go further.
Okay. So the other question is, if you can just let people know where they can follow you on Instagram, on Facebook, and where we can donate to this effort.
Absolutely. I'm not as much of a social person as everyone. I do have Facebook. I have now registered for Instagram and others.
Are you on Twitter?
No, I'm working on that.
Get one, Ms. Cooper.
So maybe I can get some help on developing that. But I do have a Facebook account. I do have a personal account, which is Akovi Javon. I typically post information about my work primarily. But then there's also a WADPI Facebook. It's called the West Africa Disaster Preparedness Initiative. It's on Facebook. If you search it by that name, it will pull up. And then we have Kofi Annan International Peacekeeping Training Center in Ghana. If you Google Kofi Annan on WADPI, so it's www.kaiptc.org.
And then there's a donation page on there, I am assuming.
There are opportunities to donate to this. We initially, as I stated, started with U.S. government funding, but we're looking at private sector, private industry. So we do need to do a better job of setting that up to encourage people to donate. But certainly, if the desire is there, we can make use of that.